Hello, my name is Dana Whitley. I am the Director of Rehab Services located on the 4th floor at Coliseum Medical Centers. During your hospital stay, you may receive a referral from your physician for rehab services. At that time, one of our nurse liaisons will come to your room to assess your care and needs to determine if you may be an appropriate candidate for rehab services before you go home. Our team of physicians, nurses, and therapists will be there to help you overcome any functional limitations brought on by your injury or illness so that you can return home safely and as independently as possible. Here are a couple of our patients and therapists to tell you about our rehab program.
Hey, I'm Emily Reynolds. I'm going to be working with you for physical therapy, and we're going to work on your walking around, going up and down some stairs, and just getting you stronger so you can go home.
Hello, my name is Vanetta Brown, and I'm an occupational therapist here at Coliseum Hospital. Occupational therapy deals with getting the patient back to the level of independency, which deal with self-care skills, bathing, dressing, everyday activities. We also help the patient with adaptive equipment that can get them back to independency, getting them in and out of the shower, and also back at home. Thank you for choosing Coliseum Rehab.
Hello, my name is Yashika. I'm one of your nurses on the rehab floor. I'll be working with you today on meds, pain management, skin, transfers, and nutrition. Thank you for using Coliseum Rehab.
I'm Tracy, and I am your recreation therapist, and my job is to make sure that you get back out going and doing the things that you enjoy so that you get back out into the community.
I'm Brianna in speech therapy, and while you're in rehab, I'll be working with you on swallowing, cognition, speech and language, and problem solving.
Several years ago in 2005, I had another stroke, and after the hospitalization, I elected to come to Coliseum, and they got me well. And then I had knee surgery at another facility, and I elected to come back here for rehab, and they got me going with that. And then last summer of 2011, I had open heart surgery at another facility, and then I elected to come here for that, and they got me going. And then I elected to participate in the cardiac rehab, excuse me, and have enjoyed that and done well. I feel good, feel better. I started out with a walker and then went to a cane and then on my own. So nothing but good things to say about Coliseum Rehab Department.
I had a stroke about 16 days ago. I fell at my house. I spent the night that night in the hospital. They moved me to the Emory Midtown facility the next day. They figured they may have to do an operation for this stroke. They did not have to do that, and I came to the Coliseum Hospital about 4 days after that at their recommendation. It's been a kind of a multi-pronged thing. Help from all the way from the nurses who come by to see you at night to take blood, which is a very common thing to do, until in the mornings when you're fed, when you're bathed. Then you're taken out by a therapist to help you work out, to do walking, to do sit-ups, to do efforts on bicycles, on safety bicycles. It's been a kind of an ongoing thing by all concerned, and a great job by everybody.
2.5 years ago, I fell in the ice and broke my ankle, and I spent about 2 months here then. They were wonderful to me, so of course there was no question in my mind where I would ever come if I needed to come back, so here I am. And everybody has just been absolutely wonderful, from the staff. I mean, everybody. I couldn't, if I had, in fact, when I left ICU, they gave me a card to pick out to pick 2 people. I said, I can't do that. Everybody is just wonderful, so how do you do that? You just put all their names on that, don't you? That's what I'm going to do.
Well, we all kind of became family in the gym because we saw each other every day, and we just got familiar with them, and they got familiar with us and knew our weakness and strength, and worked around them.
I can tell from the time I came down here from upstairs that my legs are stronger. So they know what they're doing, I can tell you that. I can vouch for that. They know what they're doing. So keep them, okay?
I think the quickest way to get in trouble for somebody like me is to go back to my old ways, sitting on a couch, doing nothing for hours at a time. I think getting back into mental therapy is very important. That's been certainly emphasized by the nurses and the therapists that I've had here. And I hope to take these things, mostly moving around and doing meaningful exercises when I get back home. I think that's what I've learned from the therapists.
Every one of them, they're just the best, honest to gosh.
They all have exhibited a tremendous amount of expertise in what they do, and they are very proud of what they do.
Just a very good experience.
I just wouldn't let them take me anywhere else but here. It has to be the Coliseum, or I'll just stay at home.
If you'd like more information about our rehab department, please contact us at 478-765-4333 or look us up on the web at COLSCNR52-46RehabServices6.com.